wellness revolution starts now.
Well, welcome to the show. My name is Jason Gourlas. I'm a provider here at Hotze Health Wellness Center. And today we're going to talk about a condition that's near and dear to my heart, attention deficit hyperactivity disorder, otherwise known as ADHD. And you might ask, why is it near and dear to my heart? Because my son is formally diagnosed with ADHD. My daughter probably has it. And if I'm being perfectly honest, I do as well. And so, there's a lot of stigma associated with mental health challenges. But what I'd like to tell you today is that ADHD is a medical disorder. It's a syndrome, meaning it's a constellation of symptoms that is genetic in nature, has neurological, nutritional, and environmental factors. That imbalances the brain, and that imbalanced brain is what leads to imbalanced behavior. So your significant other, your child, your whoever is important to you in your life that has ADHD, they're not a bad kid or a bad person. They don't have a character problem. I would not label them as messy, as lazy, or a liar. It's truly a medical problem. And it comes in three different types, essentially. There's the predominantly inattentive type, previously known as just attention deficit disorder, which is typically manifested by being easily distracted. You lose your focus, you're forgetful, you make careless mistakes. Then there's the predominantly hyperactive or impulsive subtype, which the kid is always moving or the adult's always moving. As an adult, you tend to pick jobs that are not desk jobs that require a lot of physical activity. There's an impatience that's there. They have trouble waiting their turn. They are impulsive, both in word and potentially in deed. So saying things that they later regret and doing things that they later regret. And then the third subtype would be a combined subtype, which has components of the inattentive predominant and the hyperactive impulsive predominant. And as I alluded to before, just by my introduction and the fact that I mentioned issues with jobs and the types of jobs that people with ADD tend to gravitate towards, I should say ADHD. And there used to be a distinction between ADHD and ADD. Now it's just the three subtypes. It's not just a disorder of children. And so that about 1 in 20 people have attention deficit hyperactivity disorder. And so it's not just 1 in 20 children, there's probably 1 in 20 adults that have it as well. There's significant comorbidities and consequences of having untreated disease. And one of the things that I've run across in my research with attention deficit hyperactivity disorder is that a child with ADHD gets 20,000 more negative comments made to them than their neurotypical peers. And you can imagine the toll that might take on a young child and how they might deal with that in less than optimal ways. Some of the interesting statistics around untreated ADHD shows that obviously poor school performance is a significant problem, and about 50% of children with ADHD end up either suspended or expelled. And then there's a 30% higher dropout rate for children with ADHD than their neurotypical peers. Depending on your subtype, you have a higher incidence of engaging in risky behavior like substance abuse, sex, reckless driving, and the potential consequences of those decisions. And adults with ADHD tend to struggle more with job performance, and they're about twice as likely to get separated or divorced from their spouses. Subsequent to this, there's a much higher incidence of depression and anxiety in all age groups. Now you say ADHD, it sounds like a bum deal to have. There are benefits of having ADHD, and those folks tend to be more energetic, they're creative, they're intuitive, and what the things that they're most interested in, they're very passionate about. One particular person that has ADHD that comes to mind is Jim Carrey. He's been mentioned in some of these things, and we know all the laughter that he's given the world. So the questions that we might have then is, well, what causes ADHD? And we know also from my introduction that there's a significant genetic predisposition to having ADHD. So 50% of parents of children with ADHD have it themselves. A lot of times it's unrecognized or underdiagnosed. But we also know that 75% of people with ADHD have different genes than those who don't have ADHD. And those genes are specific to certain things like neurotransmitter production and metabolism, issues with vitamin metabolism, and ultimately deficiency potentially. So I like to think of health from a 30,000-foot perspective as being contingent upon two major things, that you have sufficiency of what your body needs, and that we take away toxicity, those things that your body doesn't need or is harmful to your body. And so the things that we look at as far as deficiencies are concerned primarily would be nutrients. Lack of these nutrients ends up or manifests as lack of brain energy, and we know that underlying a significant majority of mental health challenges, if your brain doesn't have enough energy, it's not going to be able to do the things that it's designed to do. So the things that we're closely looking at as far as replenishing would be the minerals like magnesium, zinc, lithium, interestingly enough, especially if you're very impulsive, hyperactive, and you're prone to anger. Essential fatty acids like those found in cold water fatty fish, grass-fed pastured eggs, things like that. And then B vitamins, which are also significant cofactors in the production of neurotransmitters. Some of the deficiencies can be the neurotransmitters in themselves. So if you don't have the substrate to make the neurotransmitters, like adequate amounts of protein or these cofactors that are important, you may find that you're missing some of these very important neurotransmitters that have been associated with ADHD, like dopamine, norepinephrine, serotonin, GABA. Those two of the primary stimulatory neurotransmitters and two of the primary calming neurotransmitters. There may be a deficiency of connection or size and structure of your brain. When they've done MRIs of children with ADHD and adults with ADHD, they see significant volume decrease in the areas that are associated with ADHD, the frontal cortex, prefrontal cortex, parietal areas, temporal lobe, and even the cerebellum. When they look at functional connectivity between these areas of the brain, then they see that there's less, particularly in the prefrontal and frontal areas of the brain. You might have a deficiency of hormones. This is especially an issue with adult ADHD, but thyroid is an important hormone that increases energy production in the body through a variety of different mechanisms. And we talked about the importance of energy as far as brain function is concerned. Testosterone is important for a sense of confidence and for cognition, particularly in men, but not only in men, also in women. Progesterone, I call it nature's Valium. It has a very calming effect, especially when taken orally. Estrogen has been likened to nature's Prozac or serotonin. And so we know how when you are feeling happier, then you might have better focus and cognition. And DHEA, pregnenolone are what are considered neurosteroids that work predominantly in the brain, but also help to modulate immune function. And they're counterregulatory hormones to cortisol. So cortisol is found to be elevated in people with ADHD, particularly those dealing with stress and anxiety as a consequence of their ADHD. So an interesting deficiency that most people don't realize in our urban society is nature. And there's something, an issue that's been coined nature deficit disorder. And when you don't have enough exposure to time in nature, then studies have shown increased levels of stress hormones. There's impaired cognition, impaired focus, and a paucity of self-awareness, which seems to be rampant in our society today. So those are some of the deficiencies that we would look to address here, evaluate and address. But the other thing would be the toxicities. And we're awash in a chemical soup. Our children are inundated with vaccinations, and our adults too. That's not surprising with what we've been through the last 3 years. There's metals in our environment, mold, infections, and not just overt infections, but imbalance in the gastrointestinal tract that may be yeast overgrowth or overgrowth of bacteria, and that leads to inflammation in the body. And there's a significant relationship between the gut and the brain. It's called the gut-brain axis. And so when there's inflammation in the gut, there's almost guaranteed inflammation in the brain. So another toxin that we're dealing with on a daily basis and increasing consistently and exponentially is screen time. There's social media, there's gaming, there's what used to be called television. I guess there's still television, but there's also these media services. I'm not trying to badmouth Netflix or anything like that, but somebody who's given to impulsivity and somebody who would rather, there's things that they would rather do than sit down and do a bunch of paperwork or something like that. Netflix is an unfortunate escape route. And so when we know that dopamine is a problem, that specific neurotransmitter is a problem with ADHD, we see that, and studies have shown that scrolling on social media can really increase the amount of dopamine that's generated in the brain. And if you have an issue with dopamine production in the first place, then you can see how that could be potentially addictive. And that addiction takes away from things that most people should be doing, engaging with their family, their friends, and being physically active outside, enjoying nature. That also sets up issues with self-esteem, potentially in children and young adults, even adults who are concerned about their appearance and the likes that they get and things like that, and on social media. So you can see how that could play into this mental health challenge. The other thing is food sensitivities or food allergies. So there's a variety of different ways that food can cause problems in the gastrointestinal tract and thus in the rest of the body. You can have a true food allergy, which is mediated by part of the immune system called the IgE antibodies. And then there's something called delayed hypersensitivity reactions, which you may eat a food and have a problem up to 3 days later. And sometimes that food could be, or that problem could be, issues with cognition or focus or attention, impulsivity. And so we would want to evaluate you for those things, evaluate your child for those things. The other thing that can happen with food is the additives. We know there's something called a Feingold diet that has been associated with increased, when you ascribe to a Feingold diet, which gets rid of essentially colors and dyes, artificial colorings and dyes in your food, then your ADHD symptoms can be significantly mitigated. So we believe that there's an increasing incidence in ADHD. People would say that it's because of greater awareness, better diagnostic criteria, but I would say that it has to do with greater deficiencies in our environment and toxicities in our environment. So the conventional medical treatment would be to use predominantly medications. There come in two different types: stimulant medications, things like Ritalin, Concerta. The stimulant medications predominantly address dopamine, and norepinephrine increases those to help with focus and hyperactivity. It's kind of, people always ask the question, well, why would a stimulant medication increase or reduce hyperactivity? And so what it does, it just increases the focus and has a paradoxical response with hyperactivity. The other medications have a calming response, and they typically work better on children or adults with hyperactivity or impulsivity. And those fall into several different classes. Most of them are blood pressure medications like Prazosin and Tenex. And so they can be very effective, but there's an issue with potential pharmaceutical interventions for ADHD. And that is, short-term can be things like weight loss, insomnia, tics, which is involuntary movements in the face or in the extremities, and maybe even verbal tics. There's a risk for growth retardation. And then long-term consequences of medications would be heart disease, high blood pressure, seizure disorder. There is a greater propensity towards abuse and addiction with the use of these medications, and even the addition of some other mental health challenges like bipolar disorder, psychosis, and schizophrenia. So it's very important for us to come up with alternative therapies and interventions for this not rare disorder. And so a disorder that has multiple inputs also requires a multi-pronged, individualized approach. So we would like to evaluate and address any nutrient deficiencies, evaluate and address any hormonal deficiencies, evaluate and address infections and toxicity, and food sensitivities and allergies. There's an interesting therapy that is not necessarily unique to this practice, but we incorporate it in this multi-pronged individualized approach called ISIS microcurrent neurofeedback. And one of the things that have been found to be a problem in children and adults with ADHD is a weakening of these connections, and then the subsequent stress that engenders in their lives with depression, anxiety, and insomnia. Well, first, let me tell you what ISIS microcurrent neurofeedback is. It's EEG-directed transcranial electrical stimulation. And so we hook up some wires to your head, whether it's your child or your own, and the EEG, the electrical impulse from the brain, is read on the device, and it detects weak signals. It detects excessive or abnormal signals from the brain, and it sends an offset signal back to the brain. In doing so, it stimulates the production of new neurons and new connections in the brain. It stimulates the production of an appropriate production of neurotransmitters. It helps to balance the autonomic nervous system, which is the part of the nervous system that controls the automatic functions of the body: respiratory rate, heart rate, blood pressure. And that's the system that's most important for that fight or flight response that people experience, or being in that rest, digest, and repair response. And doing so, we, using this device, it encourages that rest, digest, repair response. And there's also something called the glymphatic system, which is involved intimately in detoxification of the brain, and it's been shown to increase that as well. So touching on a couple of different issues with ADHD, which is inappropriate or neurotransmitter production, usually a deficiency, and a deficiency of appropriate connections between the important areas of the brain. We found ISIS could be very beneficial in that circumstance. So it becomes apparent why a multi-pronged individualized approach is important, because there's a variety of different folks with individualized problems, and they may not have all the same deficiencies or toxicities. And so we don't want to take that cookie cutter approach with you. We understand here at the Hotze Health and Wellness Center that complex issues can be daunting, and going to your conventional medical professional would typically result in a prescription for one of these medications that we talked about. And those medications, while helpful for some, are fraught with potential side effects, and we would prefer to do something for you naturally. You weren't born with a Ritalin deficiency or a 10X deficiency. And so we would like to work with your body and your creator to address the things that your body needs and take away the things that your body doesn't. And here at the Hotze Health and Wellness Center, we look to a natural approach to help you deal with the disorders and your challenges in your everyday life. We would ask you to scan the QR code on the screen to receive a free copy of any of Dr. Hotze's best-selling ebooks located on our website, which is hotze.hwc.com. As always, if you're interested in a complimentary wellness consultation, contact our wellness consultants at 281-698-8698. That's 281-698-8698, and ask for a complimentary copy of Dr. Hotze's book, Hormones, Health, and Happiness.
At Physicians Preference Pharmacy, we believe that personalized medical treatment and customized medications are the best way to help you achieve your healthcare goals. Sometimes this requires adjusting the dosage form of the medication from something like an oral capsule to a tablet which dissolves underneath the tongue. This is called a sublingual tablet. Sub meaning under, lingual meaning tongue, under the tongue. And there are several reasons why your doctor may want your medications to be custom-made into a sublingual tablet. Perhaps you have trouble swallowing capsules or difficulty absorbing medications. With sublingual tablets, you still get the treatment you need in a way that is effective for you. Tablets made here at Physicians Preference Pharmacy are designed to dissolve fully under the tongue in just a few minutes and offer an additional option for you to achieve your healthcare goals.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.